Well, good afternoon, everybody, and welcome to the November e-learning series webinar presented by Temple Health and Bioscience District. And we are affectionately known as THBD, in case you're looking for a good way to shorten that, located in Temple, Texas. As you may or may not know, people say that we're the best kept secret in Texas, and here's why. We have a 5,000 square foot office and laboratory facility that provides equipment for prototyping, testing, 3D printing, and cell research. And as an incubator, we support startups and small to medium-sized companies with ample resources, mentorship, and a wide network of collaborators, such as the speaker you're going to hear from today. Big things are happening in the Texas life science industry, and Temple is actually one of the fastest growing cities in Texas due to the increasing presence of medical companies, hospitals, and the largest not-for-profit healthcare system in the state of Texas, Baylor Scott & White, as well as the Department of Veterans Affairs Medical Center, the largest VA medical consortium in Texas and the fourth largest in the United States. We bring in top startups and small to medium-sized businesses from around the world to foster their growth and help bring them to the next stage in their business development. So if you're interested in opportunities awaiting you in Temple, Texas, I invite you to visit us at templebioscience.org to learn more about what we have to offer. For now, I want to thank you for exploring our resources and attending this month's e-learning series webinar. It's our final webinar of 2020. If you have tuned in or if you haven't had the opportunity to join us beforehand, you can find all of our pre-recorded webinars at our YouTube channel, where we have our full library list here. You can also access those on our website under the Programs tab at the e-learning series webinar. And today's session will also be recorded and be available in our e-learning series webinar after today. For now, I want to thank Duane for joining us. And today we're going to talk about harnessing everybody's virtual strengths during the pandemic, learning how to network proactively. Duane is a friend to THBD and a medical device technical advising expert, also host of the Project MedTech podcast. And he's going to lead us in a great discussion of best practices to strengthen those professional networks amid the pandemic and business restrictions. Duane, I want to thank you for joining us today. We're so excited to hear what you have to say. And I encourage all of today's attendees to go ahead and mute your audio during the presentation, but we are going to make an open call for questions throughout. So we welcome your participation, and you can of course enter any questions into the chat at any time. And with that, Duane, the stage is completely yours.
Yep, thanks, Mary. So thank you to Tammy and Mary and the entire TPHD staff. It's a pleasure to be here, pleasure to talk. I've never personally done these before, but some of my old companies have done them, and you know, they're really exciting. I like doing them. So let me just share my screen here quickly. Can everyone see it? Just a thumbs up in the camera would be good. Yep. Okay. Very good. So as Mary said, my name is Duane Mancini. I'm coming to you live from Cleveland, Ohio. You can kind of tell by my shirt maybe there in the video, but yeah, you know, just a brief background introduction to myself. I'm a medicinal chemist by training. I spent a couple years in the farm industry, transitioned over to the medical device area at a company called NAMSA, spent some time there working with companies to limit the amount of biocompatibility testing they needed. So it was a lot of chemical characterization, all that great fun scientific stuff. I then moved into some regulatory reimbursement clinical strategy for medical devices, and then really took a complete 180 and went into business development. I did business development for NAMSA for a few years, most recently moved over to Covance, and I currently do business development for Covance's medical device team. So based on that, you're probably wondering at this point, why am I telling you about virtual networking? But It's always been a huge part of my business development career. We're going to talk a little bit about, what changed during and post COVID for a lot of people, and what really didn't change for me because I had such a heavy focus on startup companies for a long time. So, these are a lot of the stuff I'm going to talk about today are things that worked well for me. I'd love to hear participation from you guys on what worked well for you during it. If you have any questions, feel free to speak up in the middle of the presentation. I want this to be very informal, and be able to ask questions. So, and just as a caveat as well, a lot of my background is working with startups in the medical device space. I don't have a hyper focus on them anymore, but that was a large portion of my role when I was at NAMSA. So let me go to the next slide here. What's changed in the last 9 months, right? Well, a ton of it. And also real quick, guys, I'm known for short slide decks, so this is going to be great. This is 2 of like 9. I know sometimes when I'm listening to a presentation, I'm always curious on how many they're going to be. So I tend to talk a lot on them. But we want to answer the question of what's changing in post COVID. Things must go on. So a lot of issues startup companies were running into at the beginning of this, and companies in general are, how do you continue to meet investors, consultants? And I realize that's hyper focused on device, but just in general, how do you continue to network out there? How do you continue to make relationships that are going to benefit you and your company, down the road? I'm going to spend some time talking about LinkedIn. I really do think LinkedIn, when used properly, is an incredible tool. I've had a lot of success with it for customers in NAMSA world, Covance world, and in Project MedTech world. At the very end, I'll touch on what Project MedTech is, but hopefully it's going to tie the picture together for you of the full loop here. So that's really what we'll talk about at the end there. So what's changed? You'll see my dog here on the right. This is what's mostly changed for people, is a lot of us are at home. That's definitely a big change for a lot of people. For me, it's not that much of a change. I've been working at home for 6 years now. However, there's no more travel, right? So I'm with this little nugget, Zoe, pretty much all day, right? So she's literally sitting on the other side of the screen of me right now. But anyways, I think the biggest one is no more in-person conferences. Right. And that's just for everybody in the industry. And it does hurt. It's a killer. There's no med tech strategist. There's no JP Morgan. There's no Medica. I mean, those were some of the few gold mines. And there's a whole bunch of them down in Texas. But, these were gold mines for startup companies, investors, service providers, manufacturers to get out there, meet people, network, understand what's going on, and form some relationships there. And those just aren't happening anymore. Now they're being held virtually. And they can advertise it however they want. It's not the same, right? It's tough. So that's been tough. I would say that, the positive spin on this, and you have to look at the positivity, is there's more people at home. And in that way, take advantage of this. People are at home more. They're not traveling as much. So there's no more daily commute. There's no more flight times where they're unavailable. They have more time on their schedule to meet with companies, to interact. There might be some more willingness to do that, just because they're not on the road Monday through Thursday and home on Friday. So, try to take the positives of that. Also, I think, from at least a med device startup perspective, there really shouldn't be much that changed. A lot of med tech companies especially in the startup realm, are virtual already. They're kind of used to this. So the whole Zoom interaction, that should be relatively straightforward for a lot of these startup companies, because they're having to find the best talent that's possibly out there, right? You need to take geographical concerns out of that, and that's something that I've just seen in working with some of the best start med device startup companies around. Is the really good ones, they might have a couple founders or a core team in one area, but they're able to go out and find the best consultants, find the best investors, and the best teammates. So I encourage people to really look at this as positive as much as you can. But with the my goodness, I'm blanking on what I was just talking about there. The conferences being down. The biggest question is, for a startup, is how you go meet investors and consultants. At the beginning of COVID, the pandemic, and I know we're probably sick of hearing about this, but in March and April, there was a little bit of investors, hesitant to invest in new companies, and that did make it difficult for startup companies. They weren't sure how long this was going to last. They weren't sure. There's just so much unclarity. It just wasn't clear on what was going to happen, that they were holding money back a little bit. However, there is money out there now. Investors, and this is another, just put a positive spin on it. Investors, a lot of times, especially VCs, they have to invest that money, right? So there is money out there to be found and to be won if you are in that phase of trying to go out and find money. So it is out there. While we're on the topic of meeting investors, find people in the industry who know how to raise money and tap into their network, right? So there's a list by Giovanni Lorcella, where he has like 570 med tech focused or life science tech focused investors, and his list is actually growing to 1,000, in which he's going to release that I think January of next year. He gives away the list for free. All you have to do is connect with him on LinkedIn. I can include his name. I have the list, and you can send it. You can ask me for it. I'll send it to you. It's completely free, right? So it's just something that he did at the beginning of COVID to try to help startup companies, continue to find money when you don't have that avenue of these in-person conferences. And most of these in-person conferences, they really go like this, right? Startups are there chasing investors. Investors are there being chased by investors and looking for startup companies. And then you have service providers like what I do, and we're trying to connect with any of the startups, any of the investors, to explain why we can help, support. So without that being there anymore and only having those virtual conferences, this is going to make the use of LinkedIn or other, virtual settings, even like this, that much more important, because you're not having those interactions anymore. And I think that the same technique that you could use for finding these investors, right, by tapping into your network and your network's network, is how you can find consultants as well. So I think that some of this doesn't really change all that often. The next slide is really where I want to spend some time. So if you aren't on LinkedIn, you need to get on LinkedIn. I think, at least when I was in school, LinkedIn was like this place where you can go find jobs. And that's maybe what it still is today. But I could tell you that there is a large amount of people who are using it the same way I do, which is to build your professional network. And I want to emphasize professional, right? So this isn't a place. You see some people who have connected with, like, it's just they have connections with a bunch of friends, and this is your professional network that you should be able, that is digitized and will follow you no matter where you go, right? So that is the beauty of LinkedIn as well, is if you're at job A and you go to job B, a lot of times in the past, you lost all of that. Now you don't. You bring that professional network you've built over the course of your career with you, and that's really important. I should also say, as an asterisk, I'm not a spokesperson for LinkedIn. I just find their their software really good for me. So I would say, find people who have mutual connections and connect with them if they're going to bring value to your network, right? Um, I think a lot of times the tendency is to, if you go to the LinkedIn webpage, they'll be like, oh, connect with this person, this person, this person, this person. I don't encourage you to just go through and hit connect, right? You should really go through and figure out, okay, who are your mutual connections with that person? Does it make sense? Can they add value to it? And then you want to bring them into that network. And I think too, the other thing is, don't be afraid to reach out to people. This kind of ties back into the time perspective here. Is, people have more time, they're more likely to get back to you and actually answer your LinkedIn message. And as a personal example, when I started my podcast, it was really just this idea of, hey, I want to interview people in the med tech industry. And I interviewed some guests. It was going great. And then I tried to reach out to people who really had no business returning a message from me, who wants to interview them on a podcast with, at the time, maybe 20 listeners an episode, right? I mean, this is like the fourth one, and people got back to me, right? So I think it's being bold, reach out to those people. The worst thing that can happen is they don't respond, whatever. But some people will respond. And, some of these guests I've had on this LinkedIn network, or that I've reached out to, has just been really beneficial, not just in my, on my podcast, but actually building my network and figuring out, hey, what are some other areas that we can collaborate on, and that's been really beneficial for me, throughout this. I also think, so from a Covance perspective, this was a huge killer for me, right? I moved over from NAMSA to Covance in April. It was like April 27th. I moved over to Covance, and I have no way to generate any leads. There's no in-person conferences for me to attend. So this is outside of whatever their current relationships. This was the only way of reaching out to people and saying, hey, here's what we do. When the timing's right, let me know if you need something. And it turned out to be really effective. So some tips when it comes to this is, and I think we all see it. If you're on LinkedIn, you'll get some cookie cutter message from someone. And to me, there's nothing more frustrating than that, because you clearly put no thought into it. It's okay to try to have a procedure there to take something that's canned. But it needs to be a skeleton, not just word for word, take out Duane, insert Mary, right? So I think that's important. And if that's, the next piece of advice is going to be authentic, right? So if that's how you do things, and that's great. For me, that wasn't effective. For me, it was a personalized message that said, hey, John, I know you're in the cardiovascular area. This is a place where we excel. Here's some areas we support. Here's my contact information. If you think it'd be valuable, I'd love to connect with you. And I'm gonna get to some other tips on how to I guess have that wording and what worked well for me. But that's just an intro into that. The other thing too is being on LinkedIn and having your professional network. Um, Facebook, Instagram, all the other social media, right? You're sharing things about your life, right? In LinkedIn, you're sharing things about your industry. So not everybody is going to be a content creator, right? I totally understand that. However, you should find things that are interesting to your network and your industry and share those. So something I do is every post I make on LinkedIn about a new episode of the podcast, which I consider promotional content, I make 4 to 5 posts, and this isn't weekly. This is just one post for a release. I'll have 4 or 5 posts that I post that I consider good content, right? They might be posts from my podcast, but the intent isn't to, it is promoting the podcast, but it's actual content that I think taking it out and sharing it and giving some thoughts on why I think it's an important video, or why it's an important piece that Tammy's been on the podcast. I might take something out of there and say, Tammy shared this really great advice. I think it's great for everyone, and I'll post it up. But even taking articles that you find interesting, that might have, given you a good piece of advice, and sharing that with your network. That's a really good way to network with people and connect and have some of those conversations that you're missing in person, right? And I can share a few examples of times where that's how I ended up talking to someone. It was I posted a video about something, they commented on it, and we kind of got in a conversation about that, and then all of a sudden we're messaging each other on the side, and then we're having a phone call. So I think that's a good way to supplement some of these missed engagements you're having at some of these conferences. Some other tips. I think the biggest one is being authentic, and that really just boils down to being yourself. I listen to so many presentations that say, do this, do that on video. Always be in professional attire is something that I've seen a lot. And I'm here to tell you that maybe, if that's you, then that's you. Most of my videos that I have on my podcast, I'm wearing a hat and a t-shirt. I'm wearing a t-shirt right now, right? I mean, it's just, we're all at home. It's okay. But I will say, don't be afraid to turn the video function on. There is something that just, it's nice when you're on video. You can tell when people have disengaged. You could tell that people are actually engaged into what you're talking about. I think it just makes meetings a little better than just a normal phone call. So I really do encourage that. But back to being the authentic piece of this. I think the other part too, and especially this kind of ties back to the LinkedIn piece about sharing articles, is be authentic there. Find your voice. It doesn't have to. I see a lot of times people try to mimic what someone else has done who's really utilized LinkedIn well, and they try to mimic their posts. And maybe that worked for them, but that's not you. You should be you. People will appreciate it a lot more, right? I'm not going to write, a massive, a big long post about something. Mine's going to be pretty clear and concise and get to the point, because that's me. So I really encourage you to be authentic on video, but also virtually as well. The email hack. So this one's actually pretty cool. This wasn't my idea. This is something I picked up on from one of someone I've had on the podcast. His name is Gunter Wessels. He works for he runs Liquid Smart, which is a consulting firm that specializes in kind of like sales enablement and training and some other things. But something that worked for me once he told me it, and feel free to try it. But basically, you in your subject, you type your company name dash your first and last name, and that's your subject. And I was skeptical of this at first. I'll be the first one to say that. And it actually works. You know, he had said that they found that more people were willing to respond to that because it wasn't some gimmicky subject. It's worked really well for me, and I'm really surprised. You know, I don't know why. I'm sure he could explain it, but it was really interesting. And then and basically, when you get into the subject of it, so your actual text, it should be clear and concise. It should be, you know, what are you trying? What do you want to talk to them about? Why, if you don't talk to this person about this, they're going to regret it. So that's the other key thing is the fear of missing out or negative far outweighs anything that says this is why you need to do this because you'll you know it'll be so it's so positive, right? It far outweighs that. And there's a book, it's kind of based off the book The Undoing Project, which was written by Michael Lewis, and it was written about Amos Tversky and one other psychologist from Israel. But they kind of they won a Nobel Prize for behavioral economics. And that's kind of what the email was based off of. But it's letting them know what they're missing, and then, you know, suggesting a date and time to talk. That one, I couldn't believe this either. And this is maybe just my lack of attention to detail or being so raw in the business development world. I had a better hit rate on cold emails when I said, can you meet tomorrow at 4 p.m. Eastern time? Instead of saying, when is a good time that might work for you? If I leave it that ambiguous, people don't respond. Or they will respond sometimes, but most of the time they weren't responding. But if I was very direct, it was no, but I can meet this time, or yes, sounds good, send the invite. So, you know, those are just a few email hacks. They're not things that I came up with. They're just things I've learned along the way, but they've been really valuable for cold emails. And then transferring your online network to your offline network. And what I mean by this is don't just stop at reaching out to people on LinkedIn. Don't just stop at, hey, we've connected, or maybe you exchanged a couple messages. Set up some time to talk. Make an effort, even if it's 15 minutes, 30 minutes. You know, actually getting on the phone, having that initial engagement, that starts that transition of transferring them from just a LinkedIn connection or just an email to your offline network where you can reach out to that person. Even if it's, you know, even if you're you know, I understand as a startup company, your time is precious, and that translates over to any other job, right? Business development as well, right? There's a lot of companies I talk to as a service provider that have no money, right? They're not adding any they're not adding any value to me right now. However, it's worth having that conversation. It's the same thing for a startup. It's worth having a conversation with someone that you might not need their services for 3 years. And you start building that relationship, and maybe you find some mutual, maybe they can help introduce you to some other people along the way, or vice versa. So, you know, I try to make a point of that is even if it's not glaringly obvious why I should talk to this person tomorrow, I need to find time to talk to that person eventually, because it starts to transition that online network to offline network. I think I want to pause there. Real quick. Does anyone have any questions, comments, anything like that?
Actually, I do.
Okay.
I want to tell you guys about a call that I had this morning. I had met a young man at a MedTech conference that we did virtually. And immediately I reached out to him on LinkedIn following Duane's wonderful advice. And we set up a meeting, a date and a time. And it turns out that we had so much in common. We spent an hour together. This young man does clinical trials out in Canada. And it really does work. But the whole key here, what I think Duane was trying to get to you, is you need to follow up, you need to be consistent, and you need to be authentic. He gave amazingly great advice, and it really does work. So that's my 2 cents.
Yeah, no, I appreciate it, Tammy. That it makes a lot of sense. I mean, these are things that I come across all the time. So I'll give you an example as well. It just kind of popped up, right? I had a conversation this morning. Someone reached out to me and said, Duane, I have a great guest for you for Project MedTech. And I said, oh, cool. I looked into the person and I sat there and said, what? No way. I can't believe this, right? And I have the call with this person this morning, and thank goodness I did, because while it wasn't glaringly obviously based on their LinkedIn, they're putting together a really cool search engine for startup companies that you'll be able to look up service providers, regulatory folks, reimbursement folks, and it's trying to consolidate all that in one area. And I said, yeah, you would be a perfect guest. I think, thankfully we kind of reached out and talked to each other. So yeah, you're right, Tammy. It's just, you never know when it's going to happen. And that's why I really, really encourage that. I think it's harder when we're at home, right? Because you're always in front of your computer. There's always one more email you can answer. There's always one more thing you can do. Why not do this now? When you're at a conference, if you're at MedTech Strategist in Dublin, Ireland, you finish your conference day and you haven't, that's all you've been doing all day. You head over to the social hour, you have a drink and you talk to people. And that's where networks were built before, but we don't have that anymore. So you have to make time for it. I can't stress that enough and I'm sure there's other opinions. So I'm not saying I'm right, but something that I've just noticed, and coming as a scientist point of view, your network is a huge part of the success of your company, your career, and a lot of things, and who you meet. That was like and if you asked me that 5 years ago, I would have said you're crazy. But that was like my scientist mindset of like, no, there's no data to support that. Get that out of here. But it really is a big deal. Anyone else besides Tammy? Questions, comments? Great. So, we're kind of flying through this. Like I said, I don't have a lot of slides. The most of this was to just kind of talk about some tips and trades that worked for me. I think we're doing really good on time. Yeah. I know I wanted to save 10 minutes at the end for some questions as well. Project MedTech, right? So we kind of talked about it. It's a podcast. It's really just on the med tech industry. It's entrepreneurs, it's investors, it's Tammy's been on it. So it's incubators, accelerators, it's groups like this that can really help tie the industry together. It covers all facets of it. It can be found anywhere podcasts can listen, but something that the reason I will include on here, the reason I include my contact information, and the next slide will have all my contact information, is I talked on the third slide about reaching out to people whose network you can tap into, right? And making that connection. Connect with me on LinkedIn. I am more than happy to, connect people to whoever they need to be connected with, whether it's a warm introduction to investors, whether it's, hey, I need a contract manufacturer. I'll give you a list of 10 of them, right? Is it a regulatory expert? Great. I'll tell you who I enjoyed working with, who I think, might help you. And here's a list of them. Is it reimbursement support? Is it clinical? Is it sales? Is it market access? Whatever it might be. If you come to me and have a problem and I think there's someone in my network that I can help, I'll gladly make that cold or that warm introduction for you rather than a cold one. Right. So, that's really why I have the contact information here. If you want to listen to the podcast and you enjoy it, great. But if you don't, connect with me on LinkedIn. I'm happy to help where I can. I think the next slide, there we go. From a, Covance side, if you need some of these services, feel free to contact me. This is what I do in my day job when I am not hosting the podcast. In my abundance of free time, I host the podcast, which I'm about to have a lot less of in about 5 weeks or so. Yeah, here's the contact information. My cell number's on there. Both my emails are on there. I'd be more than happy to help you with anything you need. I know there might be some other companies on here that aren't med tech related. In that case, I probably can't help you much. But if you are in the med tech space, then I think I'm well suited to at least make some connections for you. The only other thing I will add is we talked about Gunter's advice. His entire episode is packed with some really, really good advice. If he didn't really care about plagiarizing, I would have just given his presentation here. But he is episode 17 of the Project MedTech podcast or thereabouts. You should listen to his podcast, reach out to him, or if you want a connection, he's got some really, really good advice. And I think that was the only one I really wanted to highlight because it really directly correlates to a lot of what I talked about today.
Hold on there. You're supposed to say that our podcast was good. Come on.
Well, if you're looking for a med tech related one, there's nothing better than Tammy's. Okay.
I couldn't resist. Could you elaborate more about that email message? First, all right, so walk us through how you pick out your cold calls, and then what do you put in that body of that email other than the appointment? Because I think that's really valuable for our listeners.
Yeah. So, for example, when I'm looking for is I'm looking for a lot like startup companies, right? A lot of times in the med tech space that are in my territory that I'm doing business development in. So like I said, the email will say Covance Duane Mancini. It's reaching out to that person. I kind of say, hey, I came across your information on LinkedIn or via website. I touch on what their device is and what space they're in. And then I tell them, where I see companies falter, right? Where do startup companies fail? And then I tell them how Covance will make sure that doesn't happen, right? So that's it's not, hey, this is what Covance does. That's why email them at that point, right? I mean, that's just a marketing email. This is an email I'm reaching out to you to say, hey, I found what you're doing interesting. And this is where, you could have problems, and here's how I can alleviate those problems. And then I suggest a time we can meet. So I think that's key is a lot of time. It's just worked for me. I don't know if the data backs this up or not. I see a lot of people who just blast, like I said, there's a lot of people on LinkedIn and emails who just blast out stuff, and they maybe they have like a 10% hit rate or less than that. But I found being purposeful, and reaching out to companies that actually interest you and stuff like that works a lot better for me than just cold emailing people or just like sending out a stock email. It should be, I personalize them. It's not the same every time. It might be a similar structure, but it's not the same every time. And it's pretty easy for startup companies to see through the BS, right? If they're just reaching out to reach out, you can tell. But if they're genuinely interested in what you're doing, you can also tell. So I think that's it, that if you're actually interested in it, it comes a lot easier. So I don't know. I mean, I think you could flip that for startups trying to find investment money, right? And if you talk to any VC, and they've said this on the podcast before, why are you seeking my money? Are you seeking my money because it's just money? Or do you think I bring some value to the board? So do some research on that person. Don't just go through and find a bunch of people and fire off a bunch of comments. Go through and say, oh, okay, Josh Phillips from Health Venture Catalyst, he's served on this board before and we have a similar product. Hey, Josh, we have this product. I'd love to pitch this idea to you. And here's why, if you say no, you're missing out. So you kind of explain to them why they should fear not talking to you almost, right? So it's the same thing that we're doing. I mean, a lot of times people see it just like, well, Duane, that's your world. And it's like, you could flip it on a lot of different ways. Yeah.
I've got a question about content, Duane.
Yeah.
In terms of specifically interacting on LinkedIn, you have that option to interact as yourself or as your company page. And I guess my question is almost twofold. Number one, for startups and entrepreneurs, is there a time when it's too early to develop a company page and start kind of pushing that out into the world? Like, is there a time where you should keep it to your individual profile?
Yeah. So I do all of my content releases as myself. I might tag my company in there, Project MedTech or Covance, depending on who it is. But I don't know. I'd have to ask more of a marketing person, what they think, about that. I would say that if it's content though, you should do it as yourself. There's a lot to be said for your personal brand. And I think that goes a long way, especially with, we keep coming back to this with finding money, but that's a big thing for startup companies, right? If you can't get grant money, you got to go raise money. People bet on the team, not the product, right? So, and this is a phrase that I've said on my podcast like 5 times because one person said it and I thought it was a good one, but they'll bet on an A jockey with a B horse over an A horse with a B jockey, right? So people like the team. So I think that it's important to build your brand there. And if you're putting out interesting content, people want to talk to you, right? People want to connect with you, and you never know what door that's going to open. And that's kind of the beauty of it. I mean, I've seen it happen so many times where it's like, I've made a comment on someone's post that they wrote and I just said, oh, this is interesting. Here's my take on it. I thought it was helpful, blah, blah, blah. Someone connects with me and then we're talking in 3 days. Right. So I would lean towards, your personal, LinkedIn. I apologize too. I realize I'm looking this way, but the screen's wide and you're right here. So, anyways, but I think it's, it should be your personal. You can share from your company page. I think that's important as well. But most of my original content is produced from my personal LinkedIn and shared on Covance or Project MedTech's LinkedIn page.
I think that's great advice. And it's cool because it circles back to that kind of original point you made about like, don't be afraid to turn the camera on. Don't be afraid to like associate an actual individual with your message.
Mm-hmm. Yeah, that's a great advice. Yeah.
I keep hearing you say that quality is over quantity, basically, is what I'm getting. Where it's better to spend more time researching and really honing in on people you want to make good contacts with than just doing blanket connections or blanket emails out, because then you're not going to get back the quality that you're looking for.
Mm-hmm. Yeah. I mean, for me, that's what's worked, right? I think if you asked I don't know. I don't know what the answer is. Like if like the traditional salesperson, right? I think for them, they might say, blast out a bunch of emails, right? And we'll just take whatever we can get. But for me, that never worked. That still takes time. And it's spammy. That's not me. So for me, what's worked and I think what's helped my rate of connecting with people is exactly that. Do your research. Make it a good quality message. Don't make a cookie cutter. And that's worked better for me. So like, for example, I had, I don't know if you're in the med tech industry, you probably know who Joe Mullings is. And if you don't, you might know his counterpart, Giovanni, who I talked about, who had the list of med tech investors. That relationship between the me and Giovanni and me and Joe, that took almost 2 years for us to actually sit down and have an in-depth conversation about how we could support each other, getting them to come on the podcast, which was a big deal for my podcast, right? They each have like some insane amount of followers on LinkedIn, like 25,000 or 50,000 or something crazy. And it was just a big name that I wanted to talk to on the podcast. But it took a couple of years of being purposeful about my comments back to each other, our interactions virtually. While it seems weird to be talking about this, but the interactions we had virtually, were really important. And they both commented on that when we actually sat down to talk for our interview. They both said, yeah, I had met one of them in Dublin 2 years ago at a conference, but it was very brief, 5 minutes. But both commented on the fact that, yeah, we've had some really good discussions virtually. And he's like, that's what led me to reply to your email about being on your podcast. So, for me, it works. And I'm gaining something that I know I want from this. I know I want to be connected with these two individuals. So you have to spend time and have good quality there. But yeah, that was a long answer of saying yes.
Hey, Duane, when you go on LinkedIn and you find somebody that you want to interact with, and you notice you have maybe 2 or 3 of common contacts, what do you say to your common contacts, and what do you say to the person once you're trying to make that soft intro?
Yeah. So if I have common connections, and it's someone that, I have a really warm relationship with, like I could tell you now, if I went on LinkedIn and this person said, oh, a mutual connection is Tammy, I would reach out to Tammy and say, Tammy, do you really know this person that well? Could you make an introduction for me? And at least ask that first, for sure. Cause that is the best way to interact with someone. Cause if they have a good relationship with Tammy and Tammy says, hey, John, you should meet Duane. He wants to talk to you about this, and this. Then that's the best way. And that's worked really well. It worked really well for me with, Manny Villafano, who was the former CEO of St. Jude and Boston Scientific. He's currently doing something else, but he'll be on the podcast eventually. But that's how that worked for me, right? Someone had a mutual connection with him, and I just said, hey, can you make an introduction? They did, and we got talking. So yeah, that's what I would do. If not, if they don't have any warm introductions, then the same principles I've talked about apply to that, new person.
Great.
Yep.
Thank you.
Mm-hmm. Any other questions?
I have a quick comment.
Yeah.
I'm not in med tech, and I've been out raising money, and I have found that once I identify a person, I do not call them unless I can find a warm connection. I'll spend 10 times as much time trying to find someone, because if you do, it's almost 100% you're going to get that meeting you want. Whereas if not, I don't know, 10 or 15%, so, or less. So I start focusing all around that person until I can find somebody. And that really works.
Yeah, that's great advice. You talk about that, and it just reminded me of someone who had reached out a couple months ago, and they had been trying to get a hold of this one VC group for a year. They submitted like 3 different applications. They said no each time. And they said, Duane, I saw you're connected. Can I connect with, will you, send an email and connect us? I did. And they had a reply and a meeting scheduled, within a week. So you're 100% right. Yep. I think that's really where you need to spend your time. And I apologize too. I just am now figuring out how to open the chat. So I saw there was like 11 messages in there. I hope I got to those questions, or if there were questions in there.
We've been playing referee for you, so you're okay, Duane.
Okay. All right. Very good. Okay. Other questions? I forget what time this goes till. Mary, is it 1 o'clock on the nose?
Yeah.
Great.
So I think it seems like the actual questions in the chat have calmed down a little bit, but it looks like Tammy wants to say something.
Wait, I lost my train of thought. Just going along with what Duane has said, what I found that I am going to try to do better is now schedule time in my weekly schedule to just work on LinkedIn. Because I do find that work happens and I get busy and I don't necessarily respond to people's messages as quickly as I could be. And I think that if you take time in your week and say, Monday morning, 9 o'clock, I'm going to work on LinkedIn for an hour or half an hour every day, I think that'll make a huge difference in your business.
Tammy, awesome advice. And it's actually, that's something, I have a reoccurring meeting on my calendar to, mine is to actually network on LinkedIn. So try to figure out, is there someone I'm missing? Should I be connecting with anyone? But I think that, you know how we have the mindset of everyone checks their work email almost daily. At the very least, I'm not saying you have to do it daily, but a couple times a week, just check your LinkedIn messages and just see if you have anything in there. If you reached out to anyone. But I think that, like Tammy said, though, setting up a weekly, 30 minutes or just whatever you can find to really spend some time on there, I think is important. I mean, it worked for me. I know it's not going to work for everyone to have these reoccurring meetings, but it works for me to know that every day or every morning at 6:30 on Tuesday, I'm going to just spend some time going through LinkedIn, making sure I responded to comments, making sure I responded to people. Did anyone like a post I have that I'm not connected with? Why? Sometimes I just reach out to that person. I've done that before. Someone liked a post of mine that is like a second or third connection. I'll reach out to them and say, hey, just wanted to connect. I saw you liked one of my messages. What was it that you liked, just to get some feedback? Was it a good message? Did it ring true with them for some reason? I try to spend time doing that as well. It sounds so, I don't know. As I'm saying it, I'm like, it sounds like, I don't know, like you should be doing it or like people are like, I know, but it's people don't do that. So.
And Duane, I'm going to pull one out of the chat from Julie, who's in a similar situation to what you were in this morning. She says that she can't turn on her mic or her camera because she's got some work folks in her house, which we understand that pain. But she says that if looking for clients or investment, she thinks it needs to be more than once a week. Yeah,
Julie, that's great advice. I have it, scheduled on my calendar for, like I said, every Tuesday at like 6:30. But I'm obviously on LinkedIn much more than that, but that's because my job dictates it. So, I think she's definitely right. I mean, I'm on LinkedIn daily. At some point or another, right? I don't have it blocked off on my calendar, but I still am on there quite a bit. So yeah, that's good advice by Julie.
I have a quick question, Duane. I think this talk has been very helpful. And, as I as I try to network more, one of the things that that I have had some struggles with are people that I reach out to. A lot of them are physicians or, medical directors, things like that. And they often are not very active on LinkedIn. So, that they're at a different level, but their LinkedIn hasn't been updated, or you try to reach out to them via LinkedIn, but you never end up hearing back. And then eventually, through some chain, at some point, if you do get in touch with them, they'll say, oh, I never checked my LinkedIn. I wanted to know, have you encountered that? And if so, do you use a couple different mediums of trying to connect to people? And, if so, what do you have any tips on, helpful tips on finding their accurate contact information if they're not,
On
a
there.
direct contact, or you don't have a warm contact
Yeah.
in between?
Yeah. So that certainly gets more difficult. If you don't have any, if you're not in that same network as they are, it does get harder to reach them if they're not on LinkedIn. There are other ways, right? If you can find sometimes you can go to you can find like for a startup company, I'll just flip it for how I know how it is, right? If I go and I can't find the founder on LinkedIn for a startup company, but I really want to talk to these people because I'm interested in what they're doing, I'll go to their website and fill out the information. And just the same kind of purposeful message applies there. And I've gotten responses from that. So that's how I've done it. I don't know how it would work for, with doctors. I doubt they have that kind of medium. But I think that you could probably, if there is that way to do it that way, you can. Yeah. But actually, and I see this comment here from Julie, talking about healthcare executives not on LinkedIn.
Mm-hmm.
It is crazy. I mean, she's completely right.
Yeah.
And that's why I push this. And I think that I think people think that like everyone's on LinkedIn, and maybe people are on LinkedIn, but they're not utilizing it. People actually utilizing LinkedIn is a much smaller group than you think. So if you can be an early adopter of this, I think it's going to be really beneficial for you. And like I said, post-COVID, COVID goes away. You're still going to have to be really active here, right? If conferences open up and you go to Medica next year in Dusseldorf, Germany, and you go there and you meet people and they're from all over the world, how else are you going to continue to keep that relationship warm, right? You might email and talk, and maybe you're not going to need their services for a couple years. But if you're posting content and you're interacting, it's the same way. It's the same reason people are on Facebook, right? It's to stay in touch with people that don't live near them anymore, that they're friends with. It's the same concept with your professional network. So I think even after all this, if you can be an early adopter of this, it's going to benefit you and in your job, your company, further in your career. So yeah, but I don't think a lot of people have adopted this yet.
Thank you.
Mm-hmm.
Duane, I think you've done an amazing job. Thank you so much for all of your help and your amazing advice. And I know it's going to help each and every one of us in our businesses. Stay safe, everyone. Mary, we are not going to have a launch and learn in December. We will start this up again at the end of January. Everybody have a wonderful holiday season, and we're looking forward to seeing you again in January. Duane, thanks again.
Yeah, thanks, Tammy.
Thanks, Duane. And everybody remember to check out templebioscience.org, where you can access that e-learning series library, see all that we've been able to do in 2020, and hopefully we'll see you in 2021. Stay healthy and safe, everybody.